Across parts of Johannesburg and Greater Gauteng regions have been advised to stock up reasonably on water ahead of scheduled maintenance by Rand Water from 24 June to 29 July. The scheduled operations include a project to connect 2 major reservoirs in Waterval to improve local water supply, among other developments. Health facilities will not be spared, but officials say this will not result in a total shutdown of the water network, but rather a reduction of water flow to taps. Let's speak now to Cathy, Seakamela, nurse and founder of Unjani Clinic, impact assessment on healthcare facilities. Mum Cathy, appreciate your time. Now let's talk about how you understand the impact of these water cuts will have, particularly in the hospitals, clinics and other healthcare facilities specifically affected by the water cuts.
Thank you, Hugo. It will affect the health sector in a very negative way, in the sense that we are trying to resolve one issue and causing a problem with another issue, in the sense that we will be seeing a lot of infections. For example, the gastrointestinal infections, for example, diarrhea, vomiting. Now, it means the queues in the hospitals, in the clinics are going to increase, because now there's a lot of cross-infection, and now it is affecting us negatively.
Do you think that there was anything else that the health authorities could do in order to better manage this process?
Yes, definitely. We always say we are running essential services, exclusion to hospitals, to clinics. That is one thing they should have looked up. Yes, it's fine, and we were prepared, like informed on time. But remember, the hospitals, we need running water. The clinics, we need running water. We are doing procedures every time and again. You see one person, and then you have to wash your hands. Yes, we will stock up, but are we using clean water? And the fact is no, because now we are stocking up on the water now.
Now, one specific area I'd like to touch on is patient care, is particularly in relation to intensive care or dialysis. Is this likely to be impacted?
Oh, definitely. Because remember, those machines, they are using running water. And as I'm saying, now, is it going to be possible that, the very same water that has been stocked up to be used in those machines? We are not even sure of how clean the water is. Now we are reinfecting our patients, especially the dialysis ones. So it's going to be a very big problem in the health sector. Yes, we understand the water sector, they are doing their job, but on the other hand, we are going to suffer as a society and as healthcare workers and our patients.
Ma'am Cathy, have you or anybody in your locale had a conversation with the water authorities to look at possibly contingency plans that may be in place at healthcare facilities to ensure that there's continuous delivery of water supply?
Yes, definitely. Like, for example, in Gauteng, Rand West, our councillors are very much involved, because they don't want that burden that will impact on us eventually. So she is trying that we be excluded, but I guess, sometimes, your hands will be tied. We can try some things, but some things we cannot go beyond. So what is happening is that, because in Gauteng, it has been going on for quite some time. So what happens is we will be having the trucks that are delivering water to our clinics, to our communities, but still it's a big problem. Remember, there are patients, or there are the elderly who cannot even go and be able to fetch the water at the corner of a street. So what do we do in those cases? So she is trying very hard. She has sent us notices, and then I guess we are complying with the authorities.
Now, one of those areas that we certainly need to talk about is issue around hygiene and sanitation and how those standards are likely to be maintained or not at healthcare facilities during the water cuts. Because I'd imagine it's not a complete cut, they say, but at some point there may just not be enough water to ensure that hygiene is maintained at the highest level.
Yes, and that is one point I've said before, that with every patient, you have to wash your hands. We have to maintain the hand clean hygiene. And then we are also doing procedures. This is a critical time for us. There are various facilities, Unjani clinics. They are performing circumcisions. We need water. So now, if we are restricted with water, you can just imagine what's going to happen. Cross-infection between staff members and cross-infection to the patients. But I guess we have to try very hard to avoid that.
Yeah, I do imagine you have to do that. But are there plans to prioritize certain healthcare services or departments over others in case of severe water shortages? Because it may not all go according to plan, right?
Yes, definitely. I just hope, for example, our tertiary hospitals where there are ICUs, they can be excluded in this case, because definitely there we need water 24/7. Neonatal ICUs, we need water. You know, those babies are very sensitive. One mistake, we have infected everybody. So you can just imagine. So I just believe authorities, they can hear this and they just act on this. Promptly so.
The final question, Mum Cathy, before we let you go. What lessons can be learned from this maintenance period to improve future preparedness where water cuts are necessary?
Maintenance has to be done, but the timing. I guess the timing, and as I said, some parts of the community or the facilities can be excluded. Do it residentially, but exclude the health facilities, because as I said before, it's going to impact on the health sector, whereas we are solving one problem and creating another problem.